Hi, the aim of this video is to recognize depression on children. All children feel low or down at times. It's a natural part of growing up, but these emotions can be worrisome when felt intensely over long periods of time, particularly if they affect your child's social, family, and school life. Although it's hard for anyone to feel optimistic when they're depressed, depression can be treated, and there are things you can do to help your child feel better. Depression is one of the most common types of mental health conditions and often develops alongside anxiety. Depression can be mild and short lived or severe and long lasting. Some people are affected by depression only once, while others may experience it multiple times. Depression can lead to suicide, but this is preventable when appropriate support is provided. It's important to know that much can be done to help young people who are thinking about suicide. So, what causes depression? Depression can happen as a reaction to something like abuse, violence in school, the death of someone close, or family problems like domestic violence or family breakdown. Someone might get depressed after being stressed for a long time. It can also run in the family. Sometimes we may not know why it happens. Depression can show up in children and adolescents as prolonged periods of unhappiness or irritability. It is quite common among older children and teenagers but often goes unrecognized. Some children might say they feel unhappy or sad. Others might say they want to hurt or even kill themselves. Children and adolescents who experience depression are at greater risk of self harm, so such responses should always be taken seriously. Just because a child seems sad, it doesn't necessarily mean they have depression. But if the sadness becomes persistent or interferes with normal social activities, interests, schoolwork, or family life, it may mean they need support from a mental health professional. Remember, only a doctor or a mental health professional can diagnose depression, so don't hesitate to ask your healthcare provider for advice if you are worried about your child. Depression can feel different for different children. Here are some of the common signs and symptoms of depression. So, as to the physical aspect, tiredness or low energy even when rested, restlessness or difficulty concentrating, difficulty in carrying out daily activities, changes in appetite or sleep patterns, aches or pains that have no obvious cause. So, as to the emotional and mental aspect, persistent sadness, anxiousness or irritability, loss of interest in friends and activities that they normally enjoy, withdrawal from others and loneliness, feelings of worthlessness, hopelessness, or guilt, taking risks they wouldn't normally take, self harming or suicidal thoughts. Experiencing one or more of these symptoms doesn't mean a child is affected by depression, but there are a number of ways you can help your child cope. If you are worried about your child, once again, do not hesitate to ask your healthcare provider for advice. So, we are going to discuss further some things that we can do to support our child if you think they may be depressed. So, first is to find out what's happening. Ask them how they're feeling and listen openly without judgment or advice. Ask people you trust who know your child, like a favorite teacher or close friend, just to find out if they've noticed anything that might be worrying them or changes in their reactions to things. Pay particular attention to their well being during important life changes like starting a new school or puberty. Second is to spend time with them. Try to build an environment of warmth, reassurance, and support by talking or doing age appropriate activities together that they will enjoy. take an interest in their life, like how their day was at school or what they love most about their friends. Number three is to encourage positive habits. Encourage your child to do the things they usually enjoy, stick to regular eating and sleeping habits, and stay active. Physical activity, such as exercise or something physical that they enjoy doing, is an important way to boost their mood. Music can have a strong influence on our mood, so try listening to songs together that make them feel positive about life. Again, do not insist on your own preference of music. Listen to what they like, but just insist on something that has a positive message. Fourth one is to let them express themselves. Let them talk to you. Listen carefully to what they say about how they feel. Never press your child to share. Instead, you can encourage other forms of creative expression like painting, crafts, or journaling their thoughts and experiences. Mood journaling can help some children let their feelings out by observing the things that make them upset or low. They can also be a great reminder of the positive aspects of their life and the things they are proud of. Number five is to protect them from stressful surroundings, although this may be very hard because personally I found some parents or some families or some relatives or some housemates that are a bit negative, or it's like they do not know how, or they feel it is impossible for them to create or protect their seemingly depressed loved one from stressful surroundings. But we should try. The key word is try. Try to keep your child away from situations where they may experience excessive stress, maltreatment, or violence. We must also remember to model healthy behavior and reactions to the stresses in your own life, including setting boundaries and maintaining positive healthcare habits. So, while we are trying to help our child or our loved one, in a way, if we are showing them positive responses to everyday stresses in our own life, then we are also helping ourselves by exercising restraint and by practicing a positive mindset and reaction towards the negative in our environment. Okay, and as mentioned earlier, we should we should seek the advice of a medical professional. But when is the right time to seek professional help? So this is a crucial question. As a depression can only be diagnosed by a qualified expert, it's important to seek help from your healthcare provider who may refer your child to a mental health expert or psychiatrist. If the mental health expert thinks your child would benefit from treatment, the options might include some form of talk therapy, where they learn how to manage their thoughts and feelings, or a combination of therapy and medication. If your child has thoughts of self-harm or has already self-harmed, seek help from emergency services or a healthcare professional. Don't delay getting in touch if you are worried. Depression can be treated, and the sooner you speak to an expert, the sooner your child or your friend or yourself, the sooner you will feel better. To end this video, we might not be healthcare professionals. We might not be able to clinically determine someone who is suffering from mental health problem, or for suffering from clinical depression or anxiety. However, we can also help our friends, our child, by showing them love, by learning to listen to them, listening to their thoughts rather than imposing. It's not all the time that we should impose to our child or impose to our partner what we want. It's not helpful, because sometimes imposing or bossing around or showing that you are king pushes them further into depression and anxiety. So it's always very important to listen. It's always very important to show compassion. But as a parent, or as a partner, or as a person, you should also be firm that they would not be able to abuse you. Of course, especially children, because if we always show compassion and we don't know when to be firm with our decisions, when we don't know when to impose, then that's the time the children will do not respect our authority or the structure of the family home. My only point is just to listen. We always have to listen and set our ego aside sometimes, and to at least try to put our children, to put our family, to put our workplace in a friendly environment, in a protected environment, to show them that we can handle stress also, and to share our thoughts regarding self-help. For example, if we are exercising, then we can influence them to exercise as well in a manner that they would enjoy or like. Go to concerts, eat well, watch basketball together, or watch movies that you like. And then just constant communication, constant listening, and constant reminder that whatever it is that they are going through, we will go through it with them. So I hope you find this video useful. God bless you. Please do not forget to like and share. Just press the notification bell for more contents. Thank you.